It's my privilege to introduce our speaker today, Dr. Limon, who has trained both in Europe and in the United States and has degrees from both the United States and European countries, particularly Germany. She has an extensive experience in clinical and research dermatology. She is quite efficient in laser procedures, cosmetic procedures. She recently received the Palm Beach County's GME Award for dermatology, being the attending of the year for 2010-2011. She has extensive reputation, both in Europe as well as the United States, in the teaching and research area as well. To go through all of her qualifications would take me longer than the lecture, and suffice it to say that she is highly experienced, highly trained in both continents and has quite a reputation. Without further ado, Dr. Limon.
What shall I say? Thank you very much for that kind introduction. So basically, I'm working here in the US in my retirement job, as I call it, because let me give you a little story. After we came back from Europe, my husband, I decided to retire, to write a book, and my husband looked after me after 4 weeks and said, honey, for the sake of our marriage, please get a job. So that's why I ended up, his condition was basically 8 to 5, less weekend work and less night work, and that's why I went to the Veterans Administration, and I'm currently the section chief here in West Palm Beach in dermatology, and it's very gratifying work and I enjoy it very much. So let's talk about a little bit about skin cancer. Next week, at the beginning of May, the American Association of Dermatology is going to start what they call Spot Orange or Melanoma and Skin Cancer Prevention Week to educate the public. And let's start here with some facts which you might not be well aware of. What do you think is the most common cancer in the US? Skin cancer, yeah. Most people don't realize this. Basically, that every American has a 1 in 5 lifetime risk of developing skin cancer. And 50% of Americans at the age of 65 will have developed at least one skin cancer. And when we look back, because we hear this and said we're going to ask ourselves, so why do we get skin cancer? And there are reasons, genetic molds, but the main reason is radiation. So we know the non-melanoma skin cancers, 90% are caused by radiation. And the melanomas are caused in 86% by radiation. So everybody's probably sitting here and said, okay, now she's gonna talk, we should wear hats, we should have sunscreen, and we should cover ourselves up. When I look outside to the people who are sitting there, nobody really does that. A little bit, everybody wants to enjoy our beautiful surroundings and the sun. And there is a reason for that. How do you feel when you're on a sunny day? How do you feel? What is your mood?
Happy.
Very happy. Okay. How do you feel after 2 weeks of rain? Everything is great. Sick. Ever heard the word winter depression up north? So people come down here because they want to escape this gray, low radiation, no sunshine climate. And if you look at a photograph of a person, picture yourself, gentlemen, beautiful woman, ladies, beautiful men. Look at them when they are pale and then they have this slightly light golden tan. What is your perception? Who is more beautiful? Probably the one with the light golden tan because it looks healthier. Would our grandparents have had the same opinion? Probably not, because at that time, paleness was considered a sign of upper class. Basically, you don't have to go, you don't have to be out in the sun. You have the luxury and the privilege not to do the work outside. At that time, tan was something which basically what they called the working class tan, but not the upper class. So when we look now at the positive effects of sunlight, everybody's going to ask me, so what's so bad about it? If you consider basically that, and look at the history basically, you have a good response. You have mood increasement, you have medication advantages, vitamin D. A lot of my patients coming now to me and said, I don't need sun protection. My doctor told me I have vitamin D deficiency, so I have to go out there. A wonderful reason for some male veterans who really insist on that. We have cosmetic reasons, as mentioned. We look better. And then we have basically avoidance factor, mostly seen in gentlemen who come into my office and tell me, I really have no idea why I'm here. My wife was bugging me because one of these molds is changing, but I have nothing. So, as human beings, what do? We love the good thing. And we do not want to see the other side of the good thing. And the other side, or sometimes as we say, look at the bright side. So what is basically the other side? It's too much of a good thing. Please keep in mind that sunlight is ultraviolet radiation. Radiation overdose can cause cancer. So let's start, how is sunlight composed? We do mainly know two wavelengths, the famous UVA and UVB. The UVA is the longer one. It goes deeper into the skin. It causes tanning. It gives us the feeling well because it targets some receptor and our brain releases the endorphins. A piece of chocolate might do that too, but sunshine is very effective in this way. But it can cause skin cancer in overdose. And then we have the second one of the ultraviolet radiation, which is the UVB. And that is the one who goes more superficial and causes the redness and the sunburn. So let's go back, and the skin cancer, but a different type of skin. So let's look back at the UVA, the long ray. It can be very beneficial. We use it for the treatment of psoriasis. We use what we call narrowband UVA, and that works very fine. So it has a good effect, but the bad effect is very interesting. It's not only the skin cancer, it causes skin aging. If you go and think, and basically we're getting 40, 50, 60, you're getting more wrinkles here in the sun exposed area. When you think that is a sign of aging, I have to tell you, no. Look at your skin in not sun exposed areas. No wrinkles. Okay? No dryness. No thickness. No scaling. You can get 70 or 80s, and I know people without minor wrinkles in your skin. You might lose a little bit fattier, but you're not wrinkling. And these people always has good sun protection. So basically we're talking about sun protection or a sunblock. It's the most cheapest and best anti-aging product which is available on the market. Works better than everything else. So now let's look what happens if we have too much of a good thing. We overdose our sun exposure. We have to understand skin can repair itself. And that is what we all know. When we are 15, 18, 20, 25, we go into the sun and we tan. We have this beautiful, even golden tan. How long we can go in the sun and get this beautiful or beautifying effect, that is depending from our skin type. And we all know the term skin type. We know Caucasian, Asian, African American. That is not how a dermatologist looks at skin. We use something what we call phototyping. And phototyping was developed by a very famous Harvard dermatologist, Tom Fitzpatrick. And he looked basically and said, okay, let's look at your genes. What is your natural hair color, your natural skin color? Basically, do you have freckles on your skin in not sun-exposed areas? And then in the second part, he looked and said, how do we react to sunshine, sun exposure? Do you tan lightly? Do you burn? Do you not tan? Do you tan deeply? And then put all this together and you get your phototype. So let me give you an example. I'm a phototype 2. I have very fair skin, but I have darker hair. But I have very light blue eyes. So if you are a natural blonde, do not tan, basically, and always get sunburn, you are phototype 1. If you're African American, you can be a phototype 4, 5, or 6. Hispanics can be a phototype 3 to 5. So for us, that gives us a much better relation, basically, to see how people will react to radiation. If you want to phototype yourself, it's very easy. If you have web access, there is an organization, skincancer.org, and they have a little program where you can phototype yourself. You just type your answers in, and you get immediately what phototype you are, and that might help you how to later apply your sunscreen and how to behave and handle the radiation. So let's look at phototyping. Now let's look at the time. We had a wonderful time in the one, let's say a skin type 1 or 2, goes out and 30, 32. Pigmentation is not that even anymore. We get this little freckled appearance. So it's not more golden, we have some white spots in there, we have some darker spots in it. It looks a little bit dirty. So we go to the beauty salon, we rub, we peel. Helps a little bit, but it gets worse. We notice it around the line, basically. Some gentlemen start, I have this little scaly rush on my ears, and I put hydrocortisone or aloe in it for weeks, and it doesn't want to go away. Your skin is telling you something. Your skin is telling you, hey, my repair is shutting down. That means your repair genes are losing their capacity to repair the damage. And that is the time for you, basically, where you could act. If you realize this, you can treat these precursors. We call them actinic keratosis or speckled pigmentation. And you could do some treatments there with creams, with freezing. Let a doctor or dermatologist please look at this, because you can, at this stage, prevent skin cancer. You have to understand one important thing there. If you do the treatment, nevertheless decide to go out in the sun, you still put the radiation, even if your skin looks better, you put the radiation on a skin which cannot repair itself anymore. So whatever you do, we can stop the process. But if you put radiation on this, you're just creating more damage. And then, basically, skin repair shuts down. So patient comes into my office with a lesion which is not healing. I tell everybody, more than 4 weeks, you did a lot of treatment, neosporin and anything, it will not heal. Please let us have a look at that. Or you get a big eczematous patch, which will not disappear, which is slowly moving out. You have one brown mole, a little brown spot, since childhood. Suddenly it's going to start to change. It gets a little bit speckled, grows a little bit, gets some border. That are warning signs, okay? And you should have somebody look at that. Because you now made it. You made it to skin cancer. And often when I see patients and they tell me, you can cut that out. Yes, I can. I can treat it with a cream. But you have to understand something. I have no medication, no drug that I can give you to reactivate your skin repair. If you do not understand this, when you had skin cancer and start going out there without appropriate protection, and I'm not arguing, covering you up, you all know the photographs with the veils and so on, appropriately, you have to protect yourself appropriately to your phototype. You will have the next skin cancer and it's only will get worse, and there's nothing what we can do. And that is something which you control. We as physicians can give you advice, but if you don't act, you are on a route to nowhere. And when we look at this basically, with this exhaustive repair capacity, what is the road to nowhere? It's depending from the phototype. Let's look at the most common form of skin cancer, that's the basal cell. That is basically phototypes 1 to 3, or what we call Caucasians. They are at risk because by nature they have less protection in their skin because they have less tanning capacity. So Caucasians get basal cell, and quite some significant amount. In 2013, approximately 2.8 million Americans will be diagnosed with basal cell. Not a nice picture. Basal cell can be cut out. We know how risk areas, it's mostly the facial areas. Keep in mind, we are here in this climate, in this high radiation environment. Basal cells develop on your nose, your ears, mostly on facial areas, and that is something we consider high-risk areas. Because if we don't remove it completely, it gets for a surgeon quite difficult to make a good cosmetic result. We call it Mohs surgery, so we take it out and we control immediately that every cell is removed. So if you wait long enough until this little papule on your nose is really because you hope it goes away and gets bigger, from a surgeon's point, we have to tell where we make a flap. So it's getting more difficult to give you a good cosmetic appearance. So what is important for the basal cell here is, if you see something which is small, we can fix that easily. But if you sit back and wait until it grows, it becomes in these areas extremely difficult for us to get a good cosmetic result. So you really want to watch these areas, especially gentlemen here. We go on the golf course, basically we have our little baseball caps because we don't want to wear what we call a broad-rimmed hat, which would protect us, because I have the impression baseball caps are more manly, or it's just a golfer's thing or a boater's thing. The problem you have, how many of you are putting sunscreen on the top of their ears? 1, 2. The other gentleman might want to think about this, because here in Florida we have a high frequency of basal cell and skin cancers on the tip of their ear because nobody thinks to protect themselves here. Also, you have skin cancers here in this area because there's no protection. A lot of people who fish out there and love to fish forget the neck area and the leg totally, completely, because we have the baseball cap on our face is shaded. So we get the skin cancer here. The other thing, which is very common here in Florida, especially with males, is the squamous cell. Here, area 2. And the squamous cell is what we call intermediate. So it's not as benign as a basal cell. It can metastasize, so it can cause some problems. Does it metastasize? Rarely. There is mostly, from my experience, a cofactor, and these cofactors could be medications. Because skin cancer likes to come to you when your immune system is suppressed. And you want to think about this. Some patients take medications for psoriasis. It's very common to do today the injections, which work extremely well for psoriasis, but it suppresses your immune system. So patients who are under immunosuppressive medication, organ transplant receivers, psoriasis patients, need at least once yearly a skin exam. We check them every 6 months because they are at higher risk for skin cancer. New studies also show that blood pressure medication might have an influence, because we just recently find out that people who are taking regular blood pressure medications have a higher risk to develop lip cancer. We don't know exactly what the reason is. It's probably how the vessels are dilated, but I tell every patient who is taking for years blood pressure medication for high blood pressure, please use a sunblock on your lip. If you're getting scales which don't go away, let us at last have a look. Most people do not know this. And lip cancer, I tell you, is not a nice thing, not even for a surgeon, because if we take that out, it will change your appearance a little bit. So a little bit sunblock, even if you don't like it and it doesn't taste good, might go a very long way there. And this is especially for the gentlemen, because women have partly protection. They use a little bit more lipstick. We have pigments in there, so we have a natural blocker in there. I haven't seen rarely gentlemen who use lipstick, so you have to go with a sunblock.
I like lipstick.
Then you have a choice. I hope you got the right color. So let's look at the most dangerous skin cancer, the melanoma. It's pretty rare, it's not very common, but 1 in 35 men and 1 in 45 of women will develop melanoma in their lifetime. I think that is quite impressive, especially if we are knowing that over the last years, with young people, the rate of melanoma is exploding between 400% and 800%, especially young women under 40. Reasons for that are multiple. It's basically beauty, adherence, and it's the frequent use of tanning salons. Most people don't realize it because tanning uses UVA, and that is just a wonderful thing for a melanoma cell because it causes the genetic mutations, and every mole will say, I love this, and go the way you don't want it to go. So young women have to be aware, young people, especially age group 20-25 is affected, okay. Children can develop melanoma, but mostly if there's a genetic predisposition. The age group mostly affected is between 10 and 20. And children, you should want to watch with yourself and everybody, if the children have a lot of moles, little brown macular spots. We get this, it's basically our birth suit. But if a child has more than 100 moles, you really have to watch this. The grown-up too, they are at higher risk for melanoma, okay? If one of these moles was ever seen by a dermatologist and excited, and we call it a dysplastic nevus, that is not a melanoma, it's a mole which is a little bit more active, your risk increases too. And if somebody in your family, first or second degree, that means not your husband, but maybe your sister or your mother, had melanoma, you are at higher risk. And that is something you have to understand when you look at your phototype. You have to calculate your risk factors too. So let's basically look how the skin cancer is exploding. As I said, in Caucasians, phototype 1 to 3, females are at risk until they are 40. Mostly a beauty thing. Then most women seem to rise up. Unfortunately, then their husbands get in the field and have an increasing rate of skin cancer because we love our activities and most men don't like sunblock. It's too greasy. I don't have time for that. So they go out, enjoy the environment, and develop the lesions. So what can you do? My husband's statement is marry a dermatologist. That probably might not work for everybody. So you can look in the mirror. Look into a mirror and have a look and say, do you see something which is not healing? Do you see a mole which is changing, a little bit square and getting bigger? And do that once a month. If you cannot see your bed, ask your wife or somebody. Ask your primary care doctor. You have no idea how many patients go to their primary care doctors and everything gets examined. The heart, the lungs. Nobody looks at the back. 5 years later, they're showing up. They're perfectly fine. They have been seen, they did everything with their blood pressure medication and everything. And I'll lift up the back and said, and how long? I don't know. I said, did anybody ever see this? No. That is a big problem because early detection will here save your life. And sometimes I get from these patients the perception that, you know, I don't get skin cancer. These are mostly Hispanics, phototype 3 to 4. African Americans never get skin cancer, they don't need to use sunscreen. This is a very big perception out there. Asians rarely use sunscreen because the perception is if I have more pigment in my skin, I'm more protected. This is in a way correct, but they do get skin cancers. Hispanics, phototype 3, 4, maybe 5, are at risk for squamous cell carcinomas. Where do they get this? In less sun-exposed areas. They get a lot of basal cells in their facial areas and they don't recognize because nobody thinks of skin cancer. Asians, same thing. African Americans are thinking they're absolutely protected and they go from phototype 4, 5, 6, but they do get melanoma. And where do they get the melanoma? In areas which have less pigments. Soles of the hand, mouth, nails. They get it basically on the soles of their feet. And the problem with this part of the population is nobody looks because everybody believes they are protected. And in this group, melanoma is more fatal, it's more aggressive, simply because these patients are recognized at a very late stage when it breaks through and metastasizes. And that is a big problem, what we have to emphasize with this group. You might have better protection, but that means you are still at risk. And most people do not realize this. So basically, after saying this, so how do you get on? You have looked at yourself, you make your yearly skin exam, and you go into treatment when you have the little precursors. You get the speckled skin. Interestingly, women are here up front because they don't like the cosmetic appearance, so they get their peelings, they get their cream treatments. Men, as usual, are far behind because they hope mostly it will go away. Right? So men mostly come with their sun damage as a very late stage, basically. They mostly come and say, I got this itchy, scaly rash, and these are the actinic keratosis, and 50 to 65% of them will develop into a skin cancer. But they perceive it as a rash. So you might inspect your husbands and convince them that aloe or hydrocortisone cream after 4 or 6 weeks will not heal the rash, and they have to take the time out of your schedule to make an appointment with a dermatologist. If you go on, you have done this, okay, how do you live now in the sun? You know you have a problem, your skin repair is shutting down or you had skin cancer. First look at your risk factors. Are you taking any medication? I mentioned that before. Is your immune system suppressed? Do you have a tendency to overdose? I would look, yeah, I want to be out there, but when? So remember the recommendation? You absolutely don't want to play out there, boat, fish, or whatever you do, or garden, between 10 and 4, because we get the highest radiation doses. Use early morning hours, use late afternoon, much better for you. Helps a lot, okay? How else can you protect yourself? Clothing. Wonderful thing, can be very fashionable, but has to be used right, okay? So let's start with clothing. Let's start with hats. Remember I mentioned before, gentlemen, baseball caps do not work. Ears and neckline. So you have to consider to find yourself a broad-brimmed hat, and there's some very nice golfer hats. There's some very nice fishing equipment where you really have something where you can protect your neck. There's a lot of information out there. Internet is a valuable source. Just simply type Google sun protective clothing. There's one thing for every taste. What you have to look at here is basically you want to really have the sun protective clothing which has a label, SPF 30. These are special fibers which will protect you. Now, to speak with my husband, okay, I have a white t-shirt, that will work, honey. No, honey, it doesn't. Because a white t-shirt has a sun protective factor of SPF 5. Out here in this environment, skin phototypes 1 to 3, you need 50 plus. So honey, put on your sunscreen and put your protective shirt on, and I might not have to do surgery on you. Otherwise, welcome to my suite. So my husband, in the end, reluctantly decided for sunspray and one of the protective shirt. He's not quite happy with that still, but he found basically because, and that is something you can help people if you buy sunscreen, adapt it to your skin type. If you're somebody who's always on the run, mostly males, they say, and you don't like grease, look at the new sun sprays. There are wonderful new sun sprays out there. My veterans prefer Bullfrog, I think it's partly the name, yeah. Neutrogena, there are a lot of companies out there, you spray it, you go on the golf because you're fine. Only one thing to remember, spray yourself completely, don't put a little bit on your hands and a little bit on your face and forget these areas, and reapply. That's one of the same problems. You all heard the recommendations, we use sunscreen SPF 30 plus. Yeah, you can do this if you apply it correctly. But most patients don't use the right amount, so I'm saying everything over 50 plus is fine with me, depending on your skin type. At least we have some protections there. So spray yourself after 2 hours, wipe a little bit your skin, spray yourself, you're fine for the next 2 hours. Take a little bottle with you and do me one favor, replace your sunscreen. Don't leave it in your car, wait for your 1 year, sunscreen goes bad. Okay, so buy the smaller bottles and refresh. That will help a tremendous lot. If you do this, you might be pretty fine. What kind of sunscreen? Some people look for the chemicals, some people don't like the chemicals. I personally like to know the sunblocks, what we call the physical blockers. Zinc oxide, because it protects both against UVA and UVB. They have a disadvantage. When you spray it on, you get slightly pale, but there's some new products on the market which avoid this. They are what they call ultra-micronized. The one thing you have to look at sunscreen, you want UVA and UVB protection, okay? Especially you want this when you have children playing on the beach. Take some of the water resistance ones. There is no sunscreen, and I have to stress this, which will last the whole day. Good marketing, but not existing. You have to reapply. And it's personal preference. Find something what you like and use it. I tell my veterans and said, okay, how do I use sunscreen? You brush your teeth, you put your sunscreen on if you had skin cancer or sun damage. If you're younger, I said, okay, it's only a question of time. You still can control this. You don't want to use sunscreen, at least use protective clothing a little bit when you go out there fishing. When you have a problem, come to me. Don't have to pay me anymore because I work for the government. Yeah. Otherwise, go to private dermatologists, pay a lot of money, and think what would have been cheaper. A little bit of sunscreen and a little bit of discipline. But if you want to pay and have the money, be my guest. Dermatologists have to live too. So basically, as I said, we have a lot of possibilities to treat sun damage and to treat this diminished repair. And that is really the point I want to stress today. Start early with treating it. Prevention helps a lot, but if you have problems with your skin, start treating it early, but do not expect that the treatment will restart your skin repair. That's gone for the rest of your life. And you really have to accept, if you're at that stage, you're done. You have no repair anymore. So every time when you go now into the sun without protection, it's the same thing. If I would say, you see the nuclear reactor there? There's this nice radioactive pool, cooling water. Have a bath. Everybody would look at me and would tell me, I'm not crazy. But you would do it with the sun. And you might want to think about this. And you might want to think about this basically, that this little monthly look at your skin can save your life. See the changing molds, see the changes, basically, and react expressively. And otherwise I would say, enjoy Florida, enjoy the outdoors. I'm not arguing here, stay inside, but know what phototype you have, protect yourself appropriately, and if you run into problems, act decisively. And that is basically the most point which I want to bring home about skin cancer prevention today. Because best skin cancer prevention medication or advisor is you, yourself, and your mirror, and your sunscreen or your sun protective clothing. Thank you very much. Any questions?
Eczema and how to treat it, how does one get that?
The eczema is basically more a laser which was originally developed for psoriasis. So I wouldn't think it's used for combination treatment. Basically what people put in cream, different types of light sources are used for that. The basic principle is, it started as photodynamic therapy. We use a substance, a cream, which basically we apply to your skin, and this cream is basically enriched in areas where cells, skin cells are hyperactive. So it enriches in there. Normal cells, which are not active, are not effective. Then we put light on that. And then we get an inflammatory, what we call inflammation. And this inflammation is wanted because it destroys the precancerous cells. So it is a very good treatment for large areas. Nice side effect, it gives you a very nice skin after a while. Some people said, okay, we could use it as a photofacial, and some people did this. And if you use these treatments for sun damage, with the creams, 5-FU is one name, Aldara is one name, but mostly 5-FU, a lot of patients come back and say, you know, I have this baby skin. Yeah, you can get with the baby skin, but it's a pretty rough way, basically, because we use a very aggressive protocol, and that means you look for 6 to 8 weeks, all red spots over the face, over your face, and everybody's going to look at you and say, do you have an allergy, or is this infectious? We got a lot of patients. We sometimes get calls from our ER and say, a patient from you is here, and I think he has a severe allergic reaction. No, it's wanted. The strength of the reaction shows you what kind of sun damage you have. I do like these cream treatments. I do like the treatments which you mentioned because it finds the areas which we even don't see with a visible eye. And it's a very effective treatment. But it does not solve your problem that your skin repair is gone. So if you think, oh, I have great skin, I go on. You go into the sun, you forget your sunscreen. The process moves. You put basically radiation on an area which cannot repair itself anymore. So you're still on the way to skin cancer. That means you can do the treatment, but you have to act appropriately after that.
Is that treatment for, I didn't hear her question, but I think it was that treatment that brings up any cancer cells, or brings it up to
The precancerous cells, yeah, for the basal cell, the squamous cells, it's not a treatment for melanoma. So,
okay. But you think that's a good idea for people to do that maybe once a year, or?
I would not use basically, I think if you want to do a treatment, there are other possibilities with photofacials and other laser possibilities. The combination of laser or blue light with the 5FU is more for stages where you really have the scaly spots on your skin.
It's straight zinc, since all chemicals, since sunscreens, the products that they have in it, the main product that I understand is zinc, and zinc doesn't have a chemical in it. So what do you think? I know you're white with all that stuff, but what do you think about straight zinc?
I do like the zinc based. That's basically what we call the physical blockers, okay? The chemical blockers are oxidants, so it's a question of preference. For me, it's more important that you have the sunscreen on. My personal preference, we have titanium dioxide and we have zinc. I like the zinc a lot because it's the only substance which protects against UVA and UVB, and you want that, okay?
The zinc is like a quarter of the price of all of those other things.
Yeah, but the zinc is basically, you can get a better cosmetic appearance. There is something now, new products coming on the market, which are called ultra micronized. So you can, it's a spray, it's called Elegant or something like that. Different companies have it, and you spray it on, and you don't get this pasty white appearance anymore. It penetrates easily into the skin. The zinc has one thing you have to, if you use it for kids and everything, it really has to reapply it every 2 hours because it gives you, the physical blockers go 30 to 40. So if you don't apply it all over the skin and don't reapply it, you might run into trouble there. That's something important to keep in mind with the physical blockers.
The
Yeah.
immune system, does that help your, if you have a healthy immune system, does that help you prevent cancer, get cancer and what?
You will get it later, okay? See, what most people don't realize, even if you have a healthy immune system, sometimes, remember the little lip blisters, the skin has its own immune system, and there are some studies were done in Europe from the University of Vienna, and there are little cells on the skin, we call them Langerhans. If you go have a 1 day on the beach, okay, and we put radiation on that, and you count the number of cells, they have disappeared for 48 hours. Then they move back into the skin again. And that's why a lot of people who basically have lip blisters say, oh, we can't go to the beach out into the sun because our herpes comes up again. Because even if you have a healthy immune system, sunlight can suppress it if you overdose. So having a good immune system helps. But if you go out there and don't protect yourself, your immune system will be shut down, at least your skin immune system, for 48 hours.
Ms. Lamont, are we making any progress with melanoma?
They say yes. We're developing new drugs pathway inhibitors, but you have to understand that it's a treatment which has a lot of side effects. And we're using that in advanced stages of melanoma. We get better survival time, 6 months, but there is a price to pay for that. Some patients are willing to pay that price. The reason why we talk about melanoma is one of the most, can be one of the most dangerous and most aggressive cancers you have. But melanoma has a 99.5 survival rate, or 100% nearly. If you treat it early, when it's a little more, when you see this is changing, you take this out, you have no problems. And for melanoma, it's very decisive. You need to look when the brown, darker spots get irritated, when they change. So melanoma, the best way is prevention. Look, just look, because which other cancer can you see in an early stage, remove it and be healed? Melanoma's problem is if you let melanoma go, and there was sometimes, historically we saw sometimes see from the countryside elderly patients coming in, because there's still the perception that, okay, if I don't touch this more, if I touch this more, you will get cancer. And we're looking at this and said, if we had touched this more, you wouldn't die. But that is a perception out there, so touching that more might have a good reason, but you have to look at that more. Somebody has to look at it. Wife, children. It's very easy. Once a month, you see if something changes.
I have, what happened to me was I had just a little tiny pimple on my nose, and I thought, well, gosh, what is that? And it wouldn't go away, and I accidentally took my fingernail and went like this. That was last year, and it got sore and sore, and when we came back from New York, I had it checked, and it was basal cell cancer, and from a little tiny, teeny weeny pimple, it turned into a great big thing that they had to cut a lot out of. And then I had another little thing that they had to check too. So it can be so teeny, and you don't think it's anything.
That's thank you. That's a very good description, because it starts a little teeny thing, so 4 weeks we ignore this. And what you describe is typical for basal cell. We touch it, it goes away. Done. Suddenly it comes back. We scratch a little bit. It comes back, goes away. Sometimes it gets a little bit bigger. That is basically everything which stays that way. Somebody has to look at. Skin cancers, the basal cells especially, have a tendency a little bit to come and go. The little pimple, the tiny, it's a perfect description from basal cell. A little pimple should disappear. It should not come back, go back and forth on the same way. That is something you really have to watch. And the interesting thing with basal cells, you might see with this tiny pimple the tip of the iceberg, because it sometimes gets little pods and move under the skin. And patients ask and say, okay, why did you have to cut this big? Because it was moving sidelines.
Well, I have one more question, the gentleman back there.
Yes?
What blood pressure medications make us more prone?
The thiazides, hydrochlorothiazides, natrium nitroprusside is mostly the most common ones, okay?
Lisinopril?
It's beta blockade. Probably I would put this under consideration too.
Metoprolol. Metoprolol.
Yeah, it's a blocker. So it's basically, we think it relates the increased rate that the vessels are dilated, and that has some effect on the immune system. It's a very, very new study, just recently came out. Yeah, next one.
Let me ask you to give we're Italo-Americans, and we're all very, very fair skinned, and my kids are always getting burnt.
Mm-hmm.
What's the best preventative thing they can do?
Sunscreen, sunblock. Teach them basically. See, I would probably say phototyping. For phototyping, we would be between a 2, even with a fair skin, probably a good 2. So you need additional protection. Sunscreen. I wouldn't put baby until after birth to 6 months. I would not put them in the sun. Okay.
What sunscreen? What formula?
I honestly like for kids. I like the physical. I like the zinc oxide sunscreens. I do like if kids are playing a lot on the beach, basically I would use one of these more permanent for 60 or 80 minutes UVA, and because they go into the water, and I just would simply watch them and said, train them after that time when you come out of the water, dry yourself, reapply your sunscreen. I would have a nice beach umbrella. I would look at the beach umbrella and said, okay, is this a normal umbrella or is this umbrella from sun protective clothing? Because you want the SPF in there. Otherwise, remember, even the umbrella, the shade gives you only a protective factor of 5 to 6. And I would tell them and said, okay, you go into the water, you have the bathing suit on. But after that, shirt on, a little wrap on or something, cover yourself a little bit. They're beautiful. If you look on the internet, I looked for my niece, they're beautiful children's clothing out there, which is very funny, and you really can show them how to behave in the sun. And if they want to go surfing, if they go older, no problem. They have surfer clothes. Look at most of the surfers. If you have skin cancer and want to go swimming in the ocean, I have no problems. You want to wear the shirts, they're swimsuits, which look good, just go where you can swim in and you're still protected. So you can go in the pool, and if you just want to do some aerobic exercise in the pool, fine with me. You had skin cancer, take the shirt on, keep your broad-brimmed hat on your head, because you're doing aerobic exercise, you're not moving very much around.
The sun is the bad guy, right?
No, the sun is a good guy too. I mentioned that. It's a question of how we handle the sun. My grandmother always said, everything in moderation. And she was a very wise woman. So if you don't go out of moderation, you will experience the bad side. The question what you have to realize and said, what is your dose? Okay, what is good for you? And when does it start becoming bad? I'm not arguing, don't go outside anymore.
You said to apply it every 2 hours or so?
Yes.
All right.
Thank you very much.
Dr. Ramon?
Yeah.
I want to thank Dr. Ramon for a very educational, informative lecture.